is this state where we are being completely rearranged. And even as a fourth time mom, I've had this is my fourth pregnancy. Haven't had any losses. Even as a fourth time mom, I'm still like, whoa, like everything is shifting. And of course, the first time you go through it, I do think it's the most radical change because we're really shifting from that archetypal journey of the maiden into the mother. But even as a fourth time mom, you have to think about it at the level of our physiology. And so what happens as we are creating this new life within ourselves, our cellular DNA is actually, well, I don't want to say it's crossing or something like that, but the baby can send stem cells, so undifferentiated cells, into the mother's body to heal different tissues. Let's just say maybe it's your heart or an old injury, a piece of scar tissue, something like that. And that gets sort of integrated into our own physiology. And I think that's a really interesting, intangible way that we see how much pregnancy actually changes us at a cellular level each time we experience it. And one of the pieces of this work that's really, really important to me and really came to fruition in my third pregnancy, which I'll share a little bit more about in a moment, is that pregnancy is actually, well, clearly it's not a disease. It's not a medical condition that needs to be managed, but it's actually a state of vitality in the body. So in the Chinese medicine tradition, we would say pregnancy is a state of excess qi and blood in the body. And I'm talking about healthy, normal pregnancy, um, where the woman's not malnourished and there's not some other big traumatic event going on. The baby is doing well, thriving. So this is a state where the body creates more blood, which we know of with hemodilution, which is when your blood volume expands during pregnancy. We're retaining that blood, so we're not shedding our uterine lining each month. We're creating amniotic fluid. We're creating another organ system, the placenta, which is established in the first trimester. And we do have excess energy in our body. Sometimes it doesn't feel like that, right? So I can answer or speak to that in a moment if anyone needs. But we do have extra resources that we don't necessarily have outside of pregnancy. And I've seen this really, really shift things for women. And I just want more women to understand that this is possible, because part of it is just changing our mindset around it. Because we've been told for a really long time that pregnancy is very depleting. Culturally, we're kind of indoctrinated to think our life sort of ends once you become a mother. It's going to ruin your pelvic floor. You're not going to want to have sex anymore. You might have incontinence or prolapse or all these other body issues, pain, birth is painful. It's just all, going to hell, basically. But what my experience has been, and what so many other women I know also experience, is, oh, actually, these symptoms that I used to have, they went away when I was pregnant. And actually, this got better. And my autoimmune condition went away, and all these things get rearranged. And yes, of course, for some women, they can have issues in the postpartum time, or X, Y, and Z can happen. But for a lot of us, and I think there's a lot of reasons for this, which I'm going to touch on, but for a lot of us, things will improve because of this genetic exchange happening. And I mean, like, literally, the stem cells are protecting the mother, because that's what life needs to keep going, right? So it's in the baby and the mother's best interest that they work together in this cohesive unit. So the baby has a lot to provide in terms of like these stem cells and even different hormones that can get involved with the journey through birth. So there's that going on. And then there is we could say, the hormonal shift that happens with pregnancy. And we get really high levels of progesterone in our system. So first, those are created by our own bodies, and then they're created by the placenta, which is, of course, part of our body. when it's inside. So it's the most progesterone you can get exposed to in your reproductive life. Why is that important? Progesterone is really protective for us as women. It's why you don't want to take hormonal contraceptives with synthetic progestin. It's why you want to have regular ovulation. And it's why during pregnancy, when we are exposed to these higher levels of progesterone, it can, for many of us, and of course, this is not true for every single person, but for many of us, it does have a bit of an anti-anxiety effect. It has a soothing effect for the nervous system. It can take our mind away from worst case scenarios, bad outcomes, always thinking of the worst possible thing, which is interesting because that is it living in juxtaposition to what the medical model perpetuates, which is pregnancy is risky. We always need to mitigate the risk. We need to do XYZ to make sure everything is progressing normally. And this is really against the hormonal matrix of pregnancy itself. The other key part of that hormonal matrix is that estrogen, of which there are 3 types. So there's estradiol, estriol, and estrone. We primarily, when we're ovulating and having our periods, we primarily make estradiol. So from the time we have our period until we go through menopause, we're primarily making estradiol unless we become pregnant. And then we're making estriol. Estriol is unique in that it still has a strong affinity for estrogen receptors, but it has an affinity in a different way. So many of you here have probably experienced this during pregnancy, is you get an increase in vaginal liquids, vaginal discharge. That's because the vaginal mucosa has a lot of receptors for this particular type of estrogen. That's protective for the vaginal microbiome, for the baby, for the cervix, and it's there for a very particular reason. When we get this shift in estrogen, it does protect us from estrogen dominant cancers long term, right? And that is something I feel like is never really discussed that much, of how protective pregnancy is into our later years. And of course, I'm really speaking to like a well-resourced pregnancy, which I know is why all of you are here, is because you do want to feel the full benefit of that. And you do want to be in a well-resourced state. So of course, if someone is malnourished, if they're using excessive alcohol or drugs or something that's a really bad situation, then yeah, that's a depleting situation. But for many of us in the modern world who, especially the women who have the capacity to show up for the Vital Pregnancy Collective, we're in a situation where this is ultimately to our benefit to be in this state of vitality and to really experience it as such. Now, where I think what happens in the modern world is that, yes, we experience this vitality. A lot of women feel great, maybe in the 2nd trimester and the 3rd trimester, you start to slow down. And then the problem is that, yes, of course, the birthing process requires a lot of qi and blood, according to the Chinese medicine system. And if we don't have proper rest and restoration of that, then all that vitality that we sort of gathered during the pregnant state, it does drain away quite quickly, right? So we will be discussing that in more detail as far as what I recommend for the postpartum time and how to set yourself up for success, because that is a time where you're really integrating and solidifying the whole pregnancy experience. And without that, it can feel like it's really left undone. It can feel like your energy is just flowing out of you and you're not able to grasp it and really bring it back to your center, right? So I'm going to pause here